Welcome to Your Health with Dr. Stephanie. School's out and there will be a lot of glorious summer days ahead filled with outdoor activities. Whether you're hiking, relaxing in the backyard with a barbecue, working in your garden, or enjoying the pool, it is always a good idea to be vigilant of the perils of summer activities. The following are some tips on how to keep you and your family safe all summer long. First, avoiding stings and bites. Use insect repellents if you're planning on being outdoors. This will help you avoid bites from mosquitoes that may contain West Nile virus and tick bites that may cause Lyme disease. There are two types of repellents, ones that contain DEET and ones that don't. Avoid placing it on your face, hands, under clothes, and on infants. If you want to use an alternative to DEET, you can look for products that contain picaridin or oil of lemon eucalyptus. To avoid sunburns, use a water-resistant sunscreen that protects you against both UVA and UVB sun rays, and that has an SPF of at least 30. Of course, if you're staying outdoors for a long time, reapplications will be necessary, and using tear-free is easier on the kids. Avoid using products that have both insect repellent and sunscreen all in one. The reason being is you will need to reapply the sunscreen more than the insect repellent, so it's better to keep them separate. And when using both, apply the sunscreen first and then the insect repellent on top. To avoid dehydration and heat stroke, which can sneak up on you quickly, don't wait to be thirsty to drink. Keep water or sports drinks with electrolytes on hand to maintain hydration and to stay indoors during the hottest parts of the day. Wearing lightweight, loose-fitting, light-colored clothes helps as well. If the body temperature rises above 103 degrees and the skin is red hot and dry without sweat, it means your body temperature regulation is failing and has lost its ability to cool down. This means heat stroke is imminent. You may also experience dizziness, disorientation, headaches, and rapid heartbeat. This is a serious medical emergency and needs to be treated quickly. Call 911 immediately, and while waiting for the emergency services, get the victim out of the sun and cool them off with whatever methods you have close, such as spraying them down with cool water from a hose. To avoid swimming accidents, always monitor children around water, no matter what their ages or their swimming capabilities. In addition, installing fencing around pools and pool and gate alarms adds another layer of protection. Drownings unfortunately happen quickly and usually silently, so avoid distractions such as reading a book, drinking alcohol, or talking on the phone. Always use life jackets while boating, and when swimming in the ocean, use a buddy system or be near a lifeguard when possible. And seconds count, so make sure you learn CPR this summer. To avoid poison ivy, the most effective way is avoidance of the plant, and this requires recognition. Remember, leaves of 3, let it be. For persons at risk, protective clothing is recommended. Vinyl gloves are useful, but rubber may not give you enough protection. Ivy block barrier cream may also reduce the severity of symptoms if exposed to it. For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.